Guys, I'm back with another interesting video about healthy tips. Your heart is crucial to your survival. It's important to keep it healthy with a well-balanced diet and exercise, and avoid things that can damage it like smoking. If you're someone who has been diagnosed with high cholesterol, it's important to understand what cholesterol is and why it's important to keep under control. Well, the best way to measure cholesterol with a blood test called a lipid panel or lipid profile. Why cholesterol matters? Cholesterol circulates in the blood. As the amount of cholesterol in your blood increases, so does the risk to your health. That's why it's important to have your cholesterol tested so you can know your levels. There are two types of cholesterol: LDL cholesterol, which is bad, and HDL, which is good. Too much of the bad kind or enough of the good kind increases the risk that cholesterol will slowly build up in the inner walls of the arteries that feed the heart and brain. Cholesterol can join with other substances to form a thick, high deposit on the inner side of the arteries. This can narrow the arteries and make them less flexible, a condition known as atherosclerosis. If a blood clot forms and blocks one of these narrowed arteries, a heart attack or a stroke can result. When it comes to cholesterol, this is what to remember: check, change and control. That is, check your cholesterol levels. It's key to know your numbers. Change your diet and lifestyle to help improve your levels. Control your cholesterol with help from your doctor if needed. Foods that may raise your triglycerides include fatty foods such as hot dogs and tropical oils, refined carbohydrates such as French fries, foods high in simple sugars such as donuts and alcohol. So it is important to avoid such foods and eat the right ones. The another way to managing your triglycerides includes fasting. While fasting, triglycerides drop because the body is burning fat for fuel. Eating high fat but low carb keeps triglycerides lower because the body is burning fat for fuel and in ketosis. When eating low fat, triglycerides stay low because there is not a lot of fat in the food and the body burns carbohydrate. When eating a low fat burrito, triglycerides stabilize because there is not a lot of triglycerides and they get burned for fuel. When eating a high fat, high carb burrito, triglycerides rise because the body starts burning carbs instead of the fat. When eating carbs together with fats, triglycerides rise because the body is burning for fuel, and being in ketosis lowers triglycerides because you are burning them for energy instead of keeping them in the blood. Lifestyle changes can help maintain healthy triglycerides levels. These changes include eating a diet low in sweets, refined carbohydrates and alcohol. By getting regular exercise, managing your weight and not smoking. Medications can also help treat impaired triglycerides levels. If your doctor prescribed medication to treat high triglycerides, it is important to take it as directed and report any side effect you may have. Your arteries, a system of tubes that transport blood around your body. Over time, the buildup of fatty material can damage and clog arteries, restricting the blood flow. This is known as atherosclerosis and can lead to heart attacks and strokes. There are several causes including high cholesterol, which can clog up your arteries over time, high blood pressure, which can damage areas in your artery wall, making it easier for fatty material to build up over time, and smoking, where chemicals in tobacco smoke can also damage arteries, leading to this fatty material built up. If a fatty deposit breaks down and ruptures, a blood clot can form around it, and this can block your artery. If this artery supplies blood to your heart muscles, it could cause a heart attack. If this art is supplied blood to your brain, it can cause a stroke. Treatments include medication, procedures to open blocked arteries, and surgery. But lifestyle changes, such as eating a healthy diet and exercising, are often the most appropriate treatment for atherosclerosis. The good thing is that you can do these things to slow down its progression. The earlier you start, the better. According to Centers for Disease Control and Prevention (CDC), 1/3 of all deaths from cardiovascular disease are caused by smoking. Smoking creates an environment in the bloodstream that leads to a destructive breakdown of cholesterol, making LDL even more toxic to blood vessels, increasing deposits of plaque in the arteries and increasing inflammation. Smoking and cholesterol levels are two main measures used to gauge your heart attack risk, along with your age, gender, and blood pressure. The risk is already significant for smokers who don't have high cholesterol, and it increases significantly if they have a high lipid. It has been reported that HDL levels can increase by as much as 30% within just 3 weeks of stopping smoking. Cardiac markers are biomarkers measured to evaluate heart function. They can be useful in the early production or diagnosis of disease. These biomarkers released into the blood when the heart is damaged or stressed. The levels of biomarkers are often used to quickly find out the size of a heart attack and how seriously your heart was affected. Cardiac troponin. This protein is by far the most commonly used biomarker. It has the highest node sensitivity. It enters into your bloodstream soon after a heart attack. It also stays in your bloodstream days after all other biomarkers go back to normal levels. Current guidelines from the American Heart Association says this is the best biomarker for finding a heart attack. The American Heart Association says to limit use of other biomarkers. If you're having or have recently had a heart attack, then you need this test. You may also need this test if you have symptoms of coronary artery blockage. This test is done with a blood sample. A needle is used to draw blood from a vein in your arm or hand. The foods that could help clean your arteries naturally, lower cholesterol, and helps prevent you from heart issues are fish. The first food that you should start consuming more is fish. Fish has a ton of healthy omega-3 fatty acid. These acids are known to have positive influences on the blood cholesterol levels, which ultimately leads to clogged arteries. Some fish you can turn to are herring, tuna, trout, mackerel, and salmon. In a study published in ARIA Atherosclerosis, citrus fruit was found to have significantly reduced systolic blood pressure. It also reduced stenosis. Foods that are high in viscose fiber protect your arteries from clogging. So having a piece of grapefruit for breakfast is a pretty yummy and healthy thing to do. Walnut is another one which improves flexibility of arteries. Green tea lowers risk of death from heart attack or stroke. There are many other foods that lower cholesterol are olive oil, berries, avocados, beans, dark chocolate, green and black teas, soy, broccoli, spinach, kiwi, apricot, banana, pear, pomegranate, etc. Omega-3 fatty acids are essential nutrients that are important in preventing and managing heart disease. Findings show omega-3 fatty acids may help to lower blood pressure. Omega-3 fatty acids lower triglycerides levels in your blood. It reduces your risk of developing an arrhythmia, that is irregular heartbeat. It slows down the rate that plaque builds up in your arteries. It also lowers your blood pressure slightly. The foods high in omega-3 fatty acids include black walnut, berries, hemp seeds, leafy greens, winter squash, beans, brassica vegetables, flax seeds, edamame, and chia seed. But the fish has a ton of healthy omega-3 fatty acids. Walnuts, rapeseeds, and flax seeds also contain high amount of omega-3 fatty acids. You might not give it much thought throughout the day, but your heart is working around the clock for you. Your heart is the most important muscle in your body because it pumps blood and oxygen to all of your organs. So keep your heart healthy. There are several ways to manage and protect your heart. Includes exercise at least 150 minutes per week. Follow an overall well-balanced diet. See your primary care physician for a yearly physical. Stay hydrated by drinking at least 64 ounces of water daily. Sleep 6 to 8 hours a night. For a healthy heart includes drink less, ditch the salt, cut the fat, get active, lose weight, lower blood pressure, good sleep, pump some iron, stop smoking, reduce stress, so that you can keep a healthy heartbeat. And with a healthy heart, the beat goes on. Thanks for watching my video. Please like and share my page Human Health and Disease. Eat healthy, stay healthy and exercise daily. We will be back soon with new updates. Goodbye, take care.